What is CPTSD? Complex Post-Traumatic Stress Disorder. CPTSD is a more severe form of post-traumatic stress disorder. It is recurring mental and emotional stress due to certain past experience. Trauma occurs when attack or abandonment triggers a fight-flight response so intensely that the person cannot turn it off once the threat is over. The person becomes stuck in an adrenalized state. PTSD comes from a known experience, for example a car accident, and the stress comes from the things that reminds of the accident. It is circumscribed. CPTSD comes from unknown experiences, from childhood neglect, and the stress comes from various things that were neglected. It is prolonged, repeated, diffuse trauma that often is in isolating circumstances. The neglected things are therefore undeveloped, and they can be self-acceptance, clear sense of identity, self-compassion, self-protection, capacity to draw comfort from relationship, ability to relax, capacity for self-expression, willpower and motivation, peace of mind, self-care, belief that life is a gift, self-esteem and self-confidence. The most common and problematic characteristics of CPTSD are emotional flashbacks, toxic shame, self-abandonment, strong inner critic, and social anxiety. Other symptoms can be feelings of loneliness and abandonment, fragile self-esteem, attachment disorder, relationship difficulties, radical mood swings, dissociation, hair-triggered fight-flight response, oversensitivity to stressful situations, suicidal ideation, feelings of helplessness and hopelessness, excessive or inappropriate feelings of guilt and shame, inaccurate perception of danger in the environment, and idealization and/or inaccurate rationalization of the perpetrator's behavior. Combinations are common. Many people who suffer from CPTSD are unaware of it, and those who have realized that they do suffer from the mentioned symptoms are often in denial about the abuse in their childhood. Emotional neglect is abuse. There are many different approaches that call themselves cures for CPTSD, but there is no direct cure, because there is no easy fix that will heal all the mentioned features of CPTSD. To recover from CPTSD, one needs to learn how to support themselves, and one has to retrain oneself in the parts that were neglected during childhood.